Hello everyone, very good morning. This is Dr. Chandni. I am a periodontist, basically a gum specialist at Clove Dental, Hyderabad. It gives me immense pleasure to welcome you all for this expert speak session. So this is a speak session which is organized on an account of International Day for Women's Health, which is on 28th of May. So today I'm going to talk about the effects, the basically ill effects of oral contraceptives on dental health. I'm sure few of you might have told what, come again? Yeah, so this is about oral contraceptives and its effect on dental health. I'm sure you must have heard about interrelationship of the medications and the dental problems. Let's just understand what does this medication do. So what are oral contraceptives? Oral contraceptives are those medications which kinds of alters the balance of your hormones in order to prevent so oral contraceptives are those medications which kinds of alters the balance of your hormones in order to prevent ovulation. So no ovulation, no fertilization, no pregnancy. Is it as simple as it sounds? No. So what is happening here is there is a shift in balance of your hormones, which is kind of affecting your overall health, including your mouth. So I have a few questions lined up by my patients regarding the same topic, which I am going to address in this session. And if you feel that there's something else we need to talk about, you are always welcome to drop it in a comment box. We would love to respond back to you. So the first question is, why are women more prone to dental problems? Is it only because of oral contraceptives? No. It is not just because of oral contraceptives. There are various physiological processes what a woman go through during her life, which includes puberty, menstruation, use of contraceptives, pregnancy, menopause. So all these life processes are somewhere associated with the hormonal imbalance, which in turn makes her more susceptible to dental problems. Like say what happens in pregnancy or during your menstruation cycle. So what happens here is, because of the shift of the hormones, you must have witnessed that just when you're PMSing, or when you brush your teeth, or when you floss, you kind of bleed while brushing. So that is all because of your dental problems and hormonal related to that. So that is why women are more susceptible, because of the physiological processes which a woman go through. Now the second question what we have is, how does oral contraceptive affect the dental problems, or does it cause dental problems? As I told you before, we are quite susceptible to dental problems, but that doesn't mean that men are immune to dental problems. We need to kind of put in a more effort to protect ourselves from dental problems. So what happens when you are on oral contraceptives? There are few changes, as I mentioned before, the hormonal changes. So how are they affecting and they are causing you dental problems? There are two possible reasons for this. The first one is, it basically reduces the blood supply to your gums. So what happens when there is reduced blood supply? So the body, it has a kind of own defense mechanism against the microbial organisms on your teeth. So when you have a reduced blood supply, your body cannot retaliate the same way as it was before. Now the second reason is an exaggerated response. So how do I put this in simpler terms? Like say you are a very calm person, you don't get into fights, or you're a very calm person, and you have someone provoking you. So you're a calm person, you don't react. Imagine now you're having a bad day and someone provokes you. How are you going to respond? So your response is going to be a little different. It's kind of more exaggerated, because you're already having a bad day, you're already irritated. Same happens with your gums. Because of oral contraceptives, your gums are kind of already irritated. And when the same kind of toxins are there, the reaction is different. So what do I mean by toxins? you have normal bacteria in your mouth. So this bacteria is it creates a layer which we call as plaque. So this is always there. Your body defense has kind of made a pace with it. Okay, this is the amount of bacteria, I can deal with it. But now when you're on oral contraceptives, they can't, because the gum is already irritated, your defense mechanism is already irritated. What they do is they create an exaggerated response, which in turn leads to dental problems. So these are the two possible reasons why one could have a dental problem when they are on oral contraceptives. Now the next question here, what we have is, what are the signs and symptoms I need to look for when I am on oral contraceptives? The first one is, there's either surge in hormones, or there is depletion of hormones during the life processes in our life. So basically they cause few red flags, which is definitely visible, like swollen gums, red gums, tender gums. So your gums they kind of have a reddish hue now than the usual tone what they had before. Next, you have swollen gums, that means enlargement, which we call as hyperplasia. Then you have food accumulation. Now this further problems what I'm going to list are nothing but the consequences of these enlargement of gums, or swollen gums, because of that. So what happens when you have swollen gums? You kind of have a pouch which is developed there, or a pocket kind of a thing, where the food gets accumulated. So when the food accumulates, it leads to halitosis or bad breath, and you kind of bleed when you're brushing or when you're flossing. These are few normal red flags which we try to ignore, but they should not be. Now there's one more uncommon problem which I would like to make it a point, is you have problems with your TMJ. So now what is a TMJ? TMJ is a temporomandibular joint. So this is that joint that kind of connects your jaw with your head. So what happens here? As I told you that the hormonal shift is kind of related to your bones as well. So when your TMJ is affected, the musculature all around your jaw and your face is kind of connected to this joint. So apparently this joint, it kind of creates further problems. There are few cases which have been reported that patients on long-term oral contraceptives feel it difficult to open their mouth or chew. So these are few things what you need to look for. The next question what we have here is, what if we are on non-oral contraceptives? Is the effect same? So I guess what the patient is referring here is an hormonal implant or hormonal patch, such kind of non-oral contraceptives. So when you are on such medications, the route of administration is different. Say if you're taking oral contraceptives, or you're taking dermal, or you're taking implant, just the route of administration is different, but the effect is going to be the same. When the effect is going to be the same, so it is natural that the side effects will more or less be the same as well. So yeah, you need to look at it into the same perspective. Okay, next question is it really important that I need to share this piece of information with my dentist? Yes, you need to, and I'll give you two valid reasons why. The first one is so that the cause of your intake of the tablet is not nullified. So what do I mean by that is, you need to prevent drug interaction. So drug interaction means when you're taking one kind of drug and then you take another kind of drug, they both interact and they either nullify or they exaggerate the effect of one of the drug or both of the drug. So what I mean to say here is, you're taking oral contraceptives in order to prevent pregnancy. Now if you don't reveal this piece of information to your dentist or your physician who might prescribe antibiotics, there is a drug interaction between antibiotics and your oral contraceptives, which in turn would nullify the effect of oral contraceptives. That means if you're having an active life and you're taking antibiotics along with your oral contraceptives, there are chances that you're likely to get pregnant. So always make it a point that when you're at the dental office, I'm sure there is a protocol where they ask you, your medical history, what kind of tablets you're on, or what kind of diseases do you have, or your conditions and everything. So make it a point to also tell them that you are on oral contraceptives, so that during the course of the treatment, and especially if antibiotics are a part of a patient care need, you need to mention it to them, so that your dentist or your physician, like say, even if you have common cold and you're taking antibiotics and then you take in oral contraceptives, that wouldn't serve the purpose. So always make it a point to reveal this information, including the dosage, including your brand, what you're taking, everything, each and every minute detail should be told to your doctor or dentist. Now the second point what I would like to say, why you need to share this information, is to avoid complications during the dental procedure or after the dental procedure. Now, like say if you have gone to extract teeth, remove a teeth for some reason. So if you are on oral contraceptives and you don't share this information with your dentist, you are likely to develop something called as a dry socket, which is a complication of extraction. So two main reasons why you need to tell your dentist regarding this. First is you need to avoid drug interaction, and the second is you need not have complications post procedure. So these are the two main reasons why you need to explain it to your dentist that you are on oral contraceptives. Now the last question what we have here is, what can I do to prevent oral problems when I am on oral contraceptives? Now you must have heard it from every dentist, and you must have seen in every ad related to dentistry that you need to brush twice. Yes, it is very important that you have to brush twice and floss once a day. So this is a must and should rule what you need to follow, irrespective of whether you are on oral contraceptives or not. This is this is the discipline what we need to follow to maintain a good oral health. Now the second thing is you need to visit dentist once in 6 months. Now few of you might ask, Doctor, I brush my teeth twice, I floss once a day, why do I need to visit a dentist? Now there are few problems which you can't see but your dentist can. You need to visit to your dentist so that you have a professional consultation done. You hear, right, prevention is better than cure. So similarly here, your dentist can look into the details at the earliest, understand the status of your gums, because while you're brushing, what you see is your pearly white teeth. What about the other structures? What about the gum? What about the bone? Only a dentist can recognize the problems at the earliest. So kindly visit your dentist once in 6 months. And there's also one more reason why you need to visit your dentist. Now, unless you have got an orthodontic treatment done, or you are like gifted with the perfectly aligned teeth, every one of us has few overlap of teeth in some corner of our mouth. So what happens there is that becomes the foci of infection. That overlapped area of your teeth becomes the area of attraction for microbial organisms to develop, which in turn would create problems from that start. So this cannot be removed, that adherence part cannot be removed by using normal brushing or flossing techniques. What you have to do is you have to go to the dentist to get an oral prophylaxis done, which is nothing but scaling and deep cleaning. So these are the two reasons why you need to visit your dentist at least twice a year. Next is use a paste that contains fluoride. A very big no to Ayurvedic paste because they don't have fluoride. You can always check into the ingredients. If they have fluoride, you can go for it. Now the next point is have a balanced diet. Having a balanced diet not just gives you that external appearance and other health benefits, but also it helps you avoid dental problems. Because when you are on a balanced diet, so balanced diet doesn't mean dieting. Balanced diet means following a lifestyle where you get equal nutrients. So when you are on balanced diet, you kind of avoid the sugary and starchy stuff. So what you do is you are in turn avoiding dental problems. So I would say that you have a balanced diet. And then the last point what I like to mention is If you are kind of experiencing a dry mouth, like say you feel like taking a lot of water, or you feel that your lips are getting dried every now and then instead of drinking sufficient water, that means you are kind of having a dry mouth, which is an early sign of few hormonal related problems on your oral health. So if you're having something like this, visit your dentist at the earliest. So I'm repeating again and again to visit your dentist, because my friends, dental treatment is not expensive, but negligence is. If you start at the first, you need not worry about the later. So that's all for today. These were the questions what I got related to oral contraceptives and oral health. I wish you